Hi, my name is Chelsey and I'm going to be your nurse today. Can I have your first name, last name, and date of birth?
Richard Venero, 7/31/91.
And let me make sure that matches, and it sure does. Thank you. And then, so what I'm going to be performing today is the head, ears, eyes, nose, and throat assessment. Do you have any questions or concerns about your personal safety today?
No.
Wonderful. I'm going to go ahead and step out and wash my hands. I'll be right back.
Okay.
All right, I am back, and I'm just going to go ahead and close this for privacy. All right, so I'm going to start with your head, and I'm just going to be feeling your skull here. Your skull is normal, cephalic, and smooth. I do not feel any lesions upon palpation. Do you feel any tenderness at all?
No.
Wonderful. And I'm looking at your hair here. I don't see any infestations, scaling, deformities, or signs of trauma. Appears that you have brown hair with average texture, no apparent hair loss or dandruff. Looking at your facial features here, everything seems to be symmetric bilaterally and bilaterally proportionate. I'm going to go ahead and move on to your eyes. Your eyebrows appear full without any sparseness. Looking at your eyelids, no drooping present. Don't see any retraction, edema, or lesions present. Your sclera looks white, and your conjunctiva appears to be pink. All right, I'm going to go ahead and do a vision test with you today. It's called, I'll be doing that using a Snellen chart. I'm going to have you place that on your right eye and just read the last line for me.
FELOPZD.
All right, perfect. And then I'm going to have you go ahead and switch to your left eye.
FELOPZD.
All right, perfect. Thank you. And it looks like you have a visual acuity of 20/20 bilaterally, so that is good. All right, so now I'm going to go ahead and check on your pupil size here. And looking at your left eye here, it appears that you have 4 millimeter pupils and 2 millimeters when restricted, 4 millimeters for your right eye, and 2 millimeters when restricted. All right, I'm going to go ahead and have you follow my finger, please. And this is checking for your extraocular movements. All right, great. And then last but not least, I'm going to have you follow my pen back to the center here. Great. Wonderful. All right, I'm going to go ahead and move on to your ears. Your ears appear to be symmetric with no lesions present. I'm going to go ahead and push on your tragus. Your pinna, do you feel any tenderness at all?
No.
Wonderful. All right, I'm going to have you go ahead and turn around.
Okay.
And I'm just going to go ahead and whisper a word. I just want you to repeat it back to me, okay?
Okay. Baseball.
Wonderful.
24.
Great. All right, you can go ahead and turn back around.
Okay.
And now I'm just going to go ahead and take my otoscope here and look inside of your ear. And I have located the tympanic membrane. It appears that you have a good cone of light in your left ear. And I'm going to take a look at your right ear. And I located your tympanic membrane, and it appears that you have a good cone of light as well in that ear. All right, moving on to your nose. Your nose appears to be symmetric, no deviation, lesion, or discharge present. Your nasal septum appears to be midline, and your mucosa appears to be pink. All right, so now what I'm going to do is I'm going to palpate your frontal and maxillary sinuses. Let me know if you feel any tenderness, okay?
Mm-hmm.
Do you feel any tenderness at all?
No.
Wonderful. So now I'm going to go ahead and check and see if you have any obstructions in your nose. I'm going to press down on your right ear, and I want you to breathe in, please. Right into your left ear. Okay, great. I don't see or feel or hear any obstructions. I'm going to go ahead and move on to your mouth and throat. I'm going to place some rubber gloves on just to make sure. Alright, just taking a peek at your lips here. I don't see any discoloration, dryness, or lesions or bumps. Alright, I'm going to go ahead and open your mouth and take a look at your teeth. It appears that you have no missing teeth and no loose teeth. Alright, I'm going to take a peek at your gums. I don't notice any discoloration, no inflammation, bleeding, appearance. Alright, I'm going to go ahead and have you stick out your tongue, please. I'm just going to palpate. I don't see or feel any lesions present. No discoloration. Your tongue is pink and moist and no rough patches. Your oral mucosa appears to be pink. Alright, I'm going to go ahead and have you stick out your tongue here and say ah. Alright, looking at your uvula and your tonsils, everything looks good. Everything appears normal. No discoloration, spots, patches, without your pharynx is without exude. Wonderful. And it appears, you stick your tongue out again, your tongue has normal range of motion as well. Thank you. Alright, so moving on to your neck here, I'm just going to feel for any masses, involuntary movements. I don't feel any masses at all. I'm just going to check your range of motion. Go ahead and turn your neck to the right and your neck to the left. Alright, perfect. I'm going to have you try to do it against my hand. Okay. Wonderful. I don't see anything wrong with your range of motion. Your head is fine, turning against resistance. And I'm going to go ahead and look at your trachea, and that appears to be midline. I'm just going to check your thyroid. No masses or lesions felt. Your neck is supple. Now I'm going to go ahead and palpate your lymph nodes, starting with your preocular. And let me know if you feel any tenderness, okay?
Okay.
And your postocular. And your tonsillar. And your submandibular. And your submental. And your anterior cervical. Posterior cervical. Deep cervical, your supraclavicular, and last but not least, your occipital. And I don't feel any lymph nodes upon palpable, that are palpable, so you are good to go. I am all done today. Are you comfortable?
Mm-hmm.
Wonderful. Do you need me to get you anything like your phone or personal belongings that aren't by you?
Nope.
All right, wonderful. I'm going to go ahead and leave this call light here for you. You call me if you need anything, okay?
Okay.
All right.
Thank you.
Yep. Have a good day.